Welcome, UC student-athletes. This seminar will discuss staph infections, severe illnesses, and traumatic brain injuries. Let's begin. Here are some typical examples of what a staph infection might look like. Pretty ugly, right? They don't all look the same, and that's the point. You need to learn how to recognize them. MRSA, better known as methicillin-resistant Staphylococcus aureus, is the type of staph infection we want to prevent the most in the realm of athletics. The next two slides have embedded videos that will provide you with important information about MRSA and how to prevent it.
I've loved sports all my life, and I learned very early just how important it is to know and respect your opponent. One of the toughest I ever faced was the one I never saw coming. A few years ago, I got a MRSA infection, and I was lucky to beat it. The fact is, more than 90,000 Americans get MRSA infections every year, and not everyone is as lucky as I was. MRSA has begun to spread into community settings like gyms, locker rooms, homes, and even schools. But there's a playbook for prevention, and just a few practical steps like washing your hands and covering your cuts can help. You also need to clean thoroughly. Here's where you want to use something like bleach to disinfect. I beat MRSA once, but I'll tell you this, I'd hate to face it again. This is one opponent we all need to know and respect. To learn what you can do in your community, visit stopmrsanow.org.
It's time to get the truth about MRSA. Here is what you need to know about the superbug.
We've heard all this talk about this new superbug, MRSA. So what exactly is it?
MRSA stands for methicillin-resistant Staphylococcus aureus. Basically, it's a type of skin infection that usually starts out in an area of injured skin and can look like a boil, pimple, or even a spider bite. The infection rapidly becomes worse, and it can be very tender, painful, and warm.
MRSA is something new, right?
The truth is, MRSA has been around for years, but it was generally only found in ill people in the hospital setting, and now it's gotten a little stronger. It's moved out into the community and the general population. It is what we call community-associated MRSA.
From the sounds of it, MRSA is a superbug. So is it really a threat?
The truth is, although it does happen on occasion, it is still rare that staph skin infections become life-threatening in a healthy person. Once diagnosed, effective treatments are available.
So is it true that people with MRSA are a threat to everyone around them?
The truth is, many people have staph bacteria on their skin normally and have no ill effects. While these people may pass the bacteria on to others, simple self-care measures can help prevent the spread of MRSA infection in yourself and keep you from spreading it to others.
I've heard MRSA can't be treated with antibiotics. Is that just a myth too?
The truth is, MRSA is resistant to certain antibiotics, but most infections can be treated with proper alternative antibiotics, and if necessary, your doctor may drain and clean the infected area. Although it is called a superbug, there is no need to panic. MRSA can be treated effectively. However, we do need to be cautious and protect ourselves, so everyone should be taking these easy steps to minimize the potential effects of MRSA. Keep your personal items personal. Don't share anything that comes into close contact with your skin, like towels or sports equipment. Keep any wound clean and covered. This will limit exposure and transmission. Always maintain good hand washing habits. Practicing good hygiene is always a good idea.
To get more information on MRSA or to find out the truth about other health concerns you have, go to visualdxhealth.com, a trusted source for today's health information. This educational video was brought to you by Logical Images, the creators of Visual DX Health, the only visually based online health resource developed by physicians for parents, kids, teens, and patients. The information contained in this video is intended to be an educational information resource. It is not intended to be a substitute for professional medical judgment.
So staph is a bacteria. In fact, it's found on all of our skin. And the most common place is right under your nose, literally. And we have our hands there all the time. Most skin infections or bacterial infections will have normal infection characteristics, such as being red, hot, swollen, and painful to the touch. And typically with staph, you're going to see a pus development. MRSA, what makes it most scary is that it is resistant to our most common types of antibiotics. And this is why it's so important to identify it early on so that we can try the lower level or more common antibiotics before having to go to the newer, more high-powered types of antibiotics that are out there today. How do you get a staph infection? Well, anyone can get one if the circumstances are right. Look at this list. Simple things, preventive-oriented. You live in a community environment here on our university campus. Take responsibility, practice good hygiene habits, keep your wounds covered and clean, and the likelihood of contracting it is going to go way down. So how serious are staph infections? If we catch them when they're small, they're not that big of a deal. But if you let something go, you ignore it, we don't want to see the things listed at the bottom of the slide happen, and they have in certain cases. Prevention, so preventable. Infections of the bloodstream. Well, characteristic. If you have a staph infection site and you start to see a red line appear moving towards the direction of the heart, that means the infection is going bloodborne. This is emergency oriented. You need to get to the doctor or the ER to get this cared for. Surgical sites are more predisposed to staph infections because it's an open portal to the body. And pneumonia. People who have pneumonia have a greatly lowered resistance level, and they can be more susceptible to staph infections other places in the body because of that. The treatment of staph infections are typically twofold. Antibiotics are the first step. If you're given a course of antibiotics, in other words, 14 pills, always take all of it. Don't stop taking it because your symptoms get better, and save it for a rainy day, because that infection may come back, and if it comes back, it'll be stronger or worse, and the antibiotic you did not finish probably will not work to take care of it the second time. Never share your antibiotic. There are too many people that are allergic to antibiotics today, and if you give your antibiotic to someone else and they're allergic and you cause their death, I wouldn't want to live with that. You shouldn't either. Don't do it. Doctors in significant staph cases will actually open the wound up and clean it out. That's what's called a lavage. That is no fun. They will clean the wound out with a sterile saline and pack it with a sterile gauze. That's no fun either. Let's just prevent these things and catch them when they're little, and you won't have to go through that. We are typically allowed to return athletes pretty quickly after they've gone through this type of lavage technique, as long as we can apply a dressing and get it fixed in place so that it doesn't fall off or become removed during active play or participation in your sport. So we'll get you back out there as quick as we can, okay? Now let's talk about the severe illnesses. Since this is a college campus, and people tend to be crammed in closer quarters, especially during the winter months, there is a higher susceptibility to communicable illnesses. This slide lists the typical symptoms we'll see with most flus. Of note is the low-grade fever. The H1N1 type A or B flu usually has a low-grade fever of 101 or less, and you just don't feel right. We need to identify these symptoms quickly because they are common for a lot of different problems. But the fever, that's key here. When treating the flu, early recognition of your symptoms is key, because if we can identify the flu within the first 48 hours of the onset of your symptoms, you can be put on Tamiflu, which has been identified to lessen the severity of your symptoms. As far as duration, it may only shorten the length of your symptoms by 1 or 2 days, but it's how severe they are that the Tamiflu can be helpful for. We do have a flu protocol that we have in place with the athletic department as well as the student services department, and if you're in the dorm, you probably will be isolated. The student services will determine how that is done. You also will probably be on a pretty liquid diet because you just don't feel like eating. And the school will make sure you get access to that diet as part of your care. So if you're in doubt about the symptoms you're having, come and see us at the training room. We will get you referred over to the student health clinic so that you can get the proper care. Whether we're talking about staph or severe illnesses, prevention is the key. And all of the items listed on this slide will go a long way to helping you prevent problems for yourself as well as for others in our college campus community. If you have any questions about staph infections or illnesses, feel free to contact the UC Athletic Training Department. Now let's talk about the TBI, or traumatic brain injury. You're noticing about now that I put a line through the word concussion. We have been advised as professionals to stop using this word as commonly as we have been. So you're going to see my staff making an effort to not use the C word as much. We will refer to brain injuries as TBIs. Research in the area of traumatic brain injuries is ongoing and constantly changing and updating. You can see 3 different sports scenarios depicted here in which an athlete has lost consciousness, probably due to a traumatic brain injury, and football isn't even shown. Here are some facts depicted from the cdc.gov website. As you can see by the pie chart, the big blue wedge is traumatic brain injuries, and it obviously shares and holds the biggest piece of the pie in annual incidence compared to other leading injuries and diseases that are out there. This slide is facts that are specific to athletic participation. The 300,000 per year number is probably an underreported number. We know that a TBI or brain injury can occur in about any sport. And of the most common sports, here at UC, we have 3 out of the 4 that are most common at the collegiate level: football, lacrosse, and soccer. It doesn't matter whether you're wearing a helmet or not. The incidence of a brain injury is just as likely to occur in a non-helmeted sport as a helmeted sport. The thing that most people are not necessarily aware of is what we call second impact syndrome. You know, if a person suffers a brain injury, and they don't report it, and they return back into play or participation before their symptoms have resolved properly, and then they suffer another brain injury while they're still recovering from the first one. This is what we identify as second impact syndrome, or SIS. It's this particular scenario that's going to result in more devastating or long-term problems for an individual. People need to be smart about these types of injuries and not be afraid to report them, because their long-term health and brain health is at risk if they don't report the initial TBI episode. When you see the abbreviation MTBI, it is referring to a mild traumatic brain injury. It is a brain injury. Are all MTBI serious? Absolutely. Anytime your brain chemistry or function is altered, it should be considered a serious injury. Women are more susceptible to MTBIs than men. Can MTBIs occur without a loss of consciousness? Absolutely. In fact, when you see MTBI, it means without a loss of consciousness in our book. What is an MTBI, or brain injury? It has to do with how the chemistry within the brain is affected when some type of traumatic force is applied. This is typically external to the skull, and it can be either direct or indirect in nature. Your brain is floating within your skull, and if a force is applied, that brain contents can shift within the skull itself, causing certain types of injuries to occur to the contents. Recognition and proper treatment should be immediate and should not be delayed, because the worst case scenario would be death. This slide provides you with signs and symptoms. The dark blue side on your left are symptoms we oftentimes will see either immediately after or a little bit after a TBI has occurred. The capital LOC is an acronym for loss of consciousness. It is a well-known fact that you do not have to lose consciousness in order for a brain injury to be diagnosed. When you see MTBI, that little m, that means mild, and we usually will align that to a TBI that does not have an LOC. The light blue side, or the right side of the screen, are symptoms that are identified as what we call post-concussion syndrome symptoms or post-TBI symptoms. These are long-term symptoms, and these are the kind of symptoms that will affect you as a student. And as you look down that list, you'll see that things like loss of intellectual capacity, poor recent memory, lack of concentration, poor attention, and anxiety, these are all things that definitely could affect you as a student. So it's really important how we treat an initial concussion when it occurs and allow symptoms to properly resolve so that we don't have these ongoing post-TBI symptoms. At least we hope we won't have them. The final slide that we're going to watch is the NCAA TBI video. It's a well done presentation. I hope you will enjoy it, and then we will have time for questions and answers after we watch it.
For me, soccer is really mental, and it's always a challenge. It's a constant thought process, always thinking hard about what would be the best strategy to prevent the other team from scoring.
In the fall of 2009, Claire Pinciero was a college freshman who was looking forward to her first season with the Princeton University soccer team. Claire realized that college athletics offered an opportunity to push herself to meet and overcome challenges, mentally and physically, in the classroom and on the field.
It's the most physically and mentally exhausting game, but after you've done well, it's like you feel like a sense of serenity.
The season was just underway when Claire suddenly found herself facing a new set of physical and mental challenges when she suffered a concussion during a preseason scrimmage.
Immediately after I got hit, I just remember having no idea where I was. I was so confused.
Like Claire, Ben Chappell was excited to have an opportunity to play college sports. As the starting quarterback for the Indiana University football team, the fifth-year senior was, at the time, enjoying a good sophomore season when he suffered a concussion in a heated conference game.
I ran the ball, was trying to score a touchdown, and the guy just kind of hit me pretty much right on the button.
Chappell takes a big hit at the 6-yard line.
The next thing I remember is the trainer coming out, asked me if I was okay.
Chappell coming off the field under his own power, but obviously not himself at the moment after that hit.
Concussions can happen at any time, to any player, at any position, in any sport. Whether the symptoms are serious or mild, a concussion is an injury that should always be addressed right away and should always be taken seriously.
Don't cover up or try to hide your symptoms. The earlier you report them, the sooner that we can take care of you properly.
Honesty in the short run may keep them out a little bit, but in the long run it's going to keep them much healthier, and it's going to give them a much longer career when they play.
Any student athlete knows that injuries are part of any sporting activity. Collisions can cause bruises, sprains, or broken bones. Like these injuries, a concussion can have an immediate, negative impact on an athlete's ability to continue to perform well on or off the field.
The real true mechanism of a concussion is related to acceleration and rapid deceleration. It's where you get a sudden change in forces, so anything that will provide a sudden stop can cause a concussion.
A concussion is a brain injury that is caused by a blow to the head or body from contact with another player, from hitting the playing surface, or being hit with a piece of sports equipment. Concussions can change the way your brain normally works and can range from mild to severe. These injuries can present themselves differently for each athlete, and they can happen in any playing circumstance in any sport.
We know that when a player has a brain injury, they tend to have difficulties with memory, particularly short-term memory. They have difficulty with how quickly they process information, how well they can think through problems, how well they can analyze problems, and how they put those all together. We know that those different aspects of brain functioning are affected in concussion. One of the key issues that we must deal with is making sure that when we return a player to play, that player is no longer having symptoms.
In order to recognize if you have a concussion, it is important that each student athlete understands the possible symptoms.
First thing you should do if you suspect a concussion is not minimize what you're feeling. Those symptoms should be reported to your medical staff at your university as soon as possible.
So I don't remember getting hit, but I think I was visibly confused and something obviously was wrong.
For Claire Pinciero, the symptoms of her concussion appeared mild at first, and then grew more severe in the hours and days that followed.
I had this constant headache, and it was basically just a migraine all the time. I was really sensitive to light and noise. My spatial awareness was really off.
It's important when you're dealing with athletes that have injuries. They're so accustomed to playing through pain. If they have an ankle sprain, they're used to getting taped up and going back into play. I think with concussion, what's important is that they need to understand how important it is that they have to be 100% before they can go back.
Claire did not lose consciousness, but the symptoms from her concussion affected practically every area of her life.
I couldn't work out because it would raise my blood circulation and go to my head, and I couldn't really listen to loud music, so I couldn't be with my friends. I couldn't really watch TV because that would hurt my eyes, which would hurt my head, and I couldn't play soccer, obviously. And school was really tough. It was really hard for me to read. I had to read at like 20-minute intervals, and then even during then it would just be such a bad pain.
Like Claire, Ben Chappell did not lose consciousness, but his collision with another player caused his concussion. Team athletic trainers led him off the field immediately.
Initially, I didn't have any symptoms. I didn't feel different at all. I think it was once I got off to the sideline, when the doctors really started asking me questions, that I realized that, something wasn't really right.
Ben's athletic trainers administered a typical sideline evaluation, the first of several important steps in the proper diagnosis and treatment of a concussion.
If an athlete presents to the medical staff with symptoms of a concussion, or an athlete is brought to the attention of the medical staff that they might be experiencing a concussion, we will first want to remove them from play to get a good assessment.
They took me through the whole concussion questions, like, can you say the months backwards, the alphabet, start with this letter and continue through this one. I think the doctor gave me 3 words to remember when we walked into the locker room at halftime.
It's very important to be honest and upfront. If we can treat your concussion properly from the start, there's a real opportunity to get those signs and symptoms to clear faster and for your concussion injury to resolve quicker.
It's important for players and teammates, as well as coaches, to work in concert with athletic trainers and team physicians to identify and treat concussions as soon as possible.
Coaches need to be able to identify that an injury has occurred, and then to get that athlete with an athletic trainer, with a physician, with a neuropsychologist, where sound medical decisions can be made.
The time for concussion to heal varies for each athlete. Ben was back on the field within a couple weeks. Claire was out for the season. However, both are now healthy and playing at 100% because both left the game immediately and received the proper medical help they needed right away. In most concussion cases, athletes can return to play with no lingering symptoms.
About 90% of concussions will resolve in terms of their symptoms within a week, but 10% don't resolve within a week. If an individual is playing still symptomatic from a previous concussion and receives another blow to the head, is that the combined effects will exacerbate the initial concussion symptoms and may prolong it a great deal, so that one has many more symptoms, they're more severe, and they last a great deal longer. It is very, very not smart to play with any post-concussion symptoms. You're risking permanent life-altering problems.
You want to be in there for your teammates and do the best you can, so I think that pressure is definitely real, but if you're not 100%, then you're probably going to do more damage to your team than good.
Concussion's a serious injury. Just like if you tore your ACL or broke your arm, it's different because you can't see it. You can't see your cast or your brace or anything like that, but it's important that you get the help from your doctors because it could have some serious symptoms.
If you feel that you or one of your teammates is suffering from symptoms of a concussion, play it smart. Don't hide it. Report it to trained medical staff immediately and get checked out. Then take the proper time to recover. Remember, it's better to miss one game than the possibility of missing an entire season or career. When in doubt, get checked out.
Thank you for watching this presentation, and always remember, when in doubt, get checked out.